Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters. Hello, everybody, and welcome back to the Her Story Circle. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating young woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Hi, Gertrude. Thank you so much for the introduction. My name is Sonia Ponzo. I'm based in London and there is no sun here. So that is very, very devastating for us. But I'm happy that it's very sunny and nice where you are. I am the CEO and founder of Outset Wellness. Outset Wellness is a company with a mission to help people form healthy habits around exercise. We all know how difficult it is to build exercise routines that really last. So what we're trying to do at Outset is we're trying to make it as easy as possible for people to plan exercise and really, really enjoy it. We take information from the weather forecast, the calendar, so we know when people are busy and when they're free. And then we have an AI engine that learns what they like and they don't like. And what this does is it maximizes chances that people will actually stick to a routine because it really helps them understand that there is time for exercise. They just need to get moving and get trying. On top of that, we're really taking a stance that exercise is not something that relates necessarily to performance and fitness. What we're trying to do is to show people that exercise can be a joyful and helpful and positive experience by itself. So we want to help people to rekindle their relationship with their bodies and with movement at large. And we are the first ones and the only ones to do that. So I'm really excited to be talking about my story, where I come from, and a little bit about Outset. So where I come from, I've been in the UK for the past now 9 years. It looks like it's been forever. And I moved here to do my PhD. But before then, I was living in Turin, which is a little town north Italy. It's like a little hometown of about 1 million inhabitants. And there, I was living in what can be called the poorest neighborhood in town. My family never had really stable income. My mom was working, different odd jobs here and there. My dad the same. And after they divorced, my mom and I were basically sharing a room in my grandparents' flat. So we had bunk beds like, kids during sleepovers, but we were mother and daughter. So that was quite an interesting experience. And that's where my story started. My mom never went to high school, but always loved reading, philosophy. She was really, really convinced that my ticket out of there was going to be through school. So she really encouraged me to read as much as possible, to go through school. And I was put through school thanks to tax reliefs and, scholarships for kids below the poverty threshold, but with good grades. And that's how my story started. And even though, my career later became incredibly fulfilling, I've covered senior leadership roles in different organizations, in health tech, from Flow Health to Helios and Yuma. And I've gotten very far, even though my very start wouldn't have been, indicative of that. And one of the things that I think is really important to me is kind of giving that idea that this is possible. So, if there are people out there listening to this thinking, oh, I could never make it, I can never be someone who starts their own company or has a fulfilling career in tech or does whatever they said they're hard to do, what I would like to tell them is, yes, you can. It's difficult. And mind you, I still sometimes have that niggling feeling that I'm just a little girl was out of place, talking to these big investors and playing with giants. It feels difficult at times and it feels like I shouldn't be here. But then I take a step back. And actually, I think, people like us, we should be here. There should be more of us. So stay strong. I think it's worth it. One thing that I would say is that what my upbringing gave me is that kind of sense of determination, that like stubbornness that people sometimes look at me like, you have this like blind conviction that things will go your way if you put enough energy into it. But that is the thing that really got me as far as I got. So, everyone kept telling me, you never get into that PhD. It's too competitive. You're never going to make it in the UK. It's too competitive. You're not going to get that role in that company because it's too competitive. You don't have enough experience. And every single time, the disbelief started to go lower, but it was still kind of there. And even to the date, now that we founded Outset, people tell me, oh, there's so many other health and fitness apps. You're never going to make it. You're never going to cut through the noise. And I know we will. We will, because we have a unique point of view, because what we're trying to bring to the table is something that deeply resonates with people so intimately, that what I believe is that people will recognize that finally there is a space for them. And why did we found Outset in the first place? And it comes from a very deeply personal experience. So even as a teenager, and as most teenagers, especially girls, but that's not necessarily the case, I really had a very complicated relationship with my body. I was the kind of girl who, would try to hide behind baggy clothes, and I would really kind of have a love-hate relationship with my own skin. And I was also the kind of girl who would be all over the new diet craze. So I would first try a new diet, stick to it as long as humanly possible, then abandon, because obviously it wasn't possible to stick to just eating boiled chicken for the rest of your life, regain the weight, and then start that kind of self-bloating cycle again, rinse and repeat. And I tried exercise, and this was up until a few years ago. I tried exercise, but I couldn't really make anything stick. I couldn't stick to a routine. I couldn't really find my groove, so to speak, until I discovered outdoor running. And don't get me wrong, it wasn't an easy, happy path of, birds singing and everything going smoothly and swimmingly. It was difficult to learn how my body would go through the motion and how to actually leverage that to my benefit. But at the end of the day, the moment it clicked, the benefits on my health were so astounding, so incredible. I started sleeping. I started, not craving bad foods, not craving alcohol. My health just was kicked into place by running, basically. And so I stick to it. But then something happened. I'm a very competitive person, and I know that there is this unhealthy competition side to everything I do. And so what happened is I started getting slowly addicted to it. And getting addicted to running itself wasn't much of the problem. The problem was the social aspect of it. I started being very aware and very worried about showing only the good runs on social medias, uploading things that I knew would make me look good, but they were not necessarily good for my body. And that led to 2 overuse injuries, both of them completely avoidable, both of them things that I could have very, very easily not got into if I just listened to my body, which is what I now preach to everyone. But what that made me realize is that we come into exercise with such a baggage. It's not just about motivation to exercise and getting the sneakers on, but it's about our nightmares from physical education, how we perceived our body, not feeling sporty enough, not feeling like we look good in those shorts, not feeling strong enough, not feeling as buffed as the guy who was training next to us in the gym. And all of that just gets condensed into this, I don't want to exercise. I don't want to engage with all of that because it's a lot. And so the moment that I realized that we needed to create a different space for people. We needed to create something where they would feel safe, understood, like they belonged. A space where we rethink exercise as something that is just good for you because of itself, rather than because of performance metrics, how fast you run or how much you can lift. And all of this really is the thing that keeps me up at night, because I know that we can do it. I know that it's going to do a lot of good. And I know that I'm going to see it through. And at the end of the day, what we're trying to do is kind of creating a movement for movement, if you will. So we're trying to get people to be in touch with their own bodies again, and understand all the good that can come from something as simple as just walking outdoors and have a bike ride or a run, or even like a yoga session at home. Whatever works for them is fine.
That is absolutely wonderful.
Thank you.
Thank you so much for sharing your story, Sonia. It's amazing how this is such a common story for a lot of women. You're not the only one. We all go through this. And it's time that I guess we reframed how we think about our bodies, how we help ourselves to control the weight or live healthy, I think is the most important thing that's necessary right now. And now with social media and young people seeing all kinds of things online, it's actually more difficult for young women to love the way they look,
Yeah.
which is a real pity. So let's talk a little bit about your journey into entrepreneurship.
Yeah.
How did your educational background in neuropsychology influence your career path? And what motivated you to transition from academia to digital health industry?
That's a very good question. So I started out working as a researcher. So my PhD and all the research that I was doing before was kind of all geared towards understanding how people perceive their own bodies. So it was I don't know if you ever heard about the rubber hand illusion, that illusion where you put a fake hand in front of someone, you stroke their hidden hand, and then the fake hand, and the person thinks that the fake hand is their own. So I was
Right.
studying all that kind of stuff, right? To basically try and understand how we humans feel that this body, this one, is mine. And all of that kind of gave me this concept that everything starts with the body. There is no mind body connection. There is just the body, and it's all one thing, right? And
Yes.
and the thing is that when that clicked, what I realized is that what I wanted to do was to try and bring this kind of knowledge of everything starting with the body in a setting where I could really make some impact. And that's
Yes.
how and that's how I landed my first job as a research scientist in industry, because the CEO, who was my boss back at the time, was also very, very into this idea that everything starts with the body, that trauma is something that we store in the body. So we just clicked during the interview, and now he's still one of our advisors at Outset. So it's someone that really, really shaped my career going forward.
Wow. How fascinating. It is interesting the way you position that. It makes you think. So there's been a lot of challenges, and it seems like you've managed to overcome them. Navigating entrepreneurship as a woman from a humble background presents unique challenges. Can you share some of the obstacles that you've faced and how you've overcome them?
Yeah, absolutely. I mean, the big one is you have no network. Like you come to, so you have a network from your career, but those are not necessarily investors. Those are
Yeah.
people who, other professionals, other colleagues, to build that initial network where you know how to talk to investors. Like they kind of at the beginning, they seemed like they were this mythological figure. It's like, these investors, and you don't know how they think, and you need to they're obviously just people who are trying to make an investment. But in my mind, it was this like, wow, I don't know how to approach that world. I haven't gone to the schools they have gone to. I don't know the same people they know. They meet each other and they meet other founders at events that I'm not invited to. How do I break into that?
Yes.
And I think the answer to that is mainly the community around you. Like you would be surprised at how much help we got from our advisors. So David being one of them, the CEO of BioBeats that I was mentioning. So he was the one that tried to open as many doors for us as possible. The same is true for people in other communities. We have a very big WhatsApp community of women in health tech that is kind of London based, and there is people scattered all around the world. And that has been so, so helpful in just getting connections, talking to people, building up the courage to then go and approach investors. That's kind of what it is, community.
I love it. So, mentorship. How has mentorship been important on your journey? And what advice do you give to others who are seeking mentorship?
That's a great one. So on my side, as a mentee, I've been very lucky to have people on my journey that just saw me and saw that I had potential and just gave me everything that I needed to succeed. David being one of them, Davide, who was our CTO, being another one, and my partner Nick, who's also in the company with me, is another one of those people who simply, when you have someone in your life, obviously, you can call him a mentor, but it's someone very important in shaping the way I feel about myself. Someone
Yes.
who always puts you up, always makes you feel better than you would otherwise.
Yeah.
I've been so lucky and surrounding myself with these kind of people around me. And at the same time, from a mentee perspective, so from a mentor perspective to mentees, what I would say is do not be shy about reaching out to people. You have no idea how many people reached out to me to ask for advice, to ask for mentorship. And I made a pledge. I respond to every single one of them. Every junior person that comes from my LinkedIn, I will talk to them because I've made some of the best relationships in my life in this way.
So in a way, you're kind of giving back or paying it forwards, right?
That is exactly what it is. Like I made a vow that I will do this every time someone junior reaches out to me. And that's how we got our latest developer, Steffi. She reached out to me on LinkedIn. We had a chat and she started working with us.
Now, Outset Wellness, how does this company aim to transform physical inactivity into vibrant health?
Good one. So I think we are approaching this from 3 different angles, right? So when you think about what the barriers to exercise are, you can say that there is one big problem when it comes to the approach to fitness. It's kind of what we were talking about earlier, which is people don't feel sporty enough. People don't feel exercise is for them. It's like there is this big bubble that, they just say, no, I don't want to have anything to do with that. So that is the first problem that we need to approach. We need to change the conversation around fitness. The second one is planning. So people say they don't have time, but everybody knows you do have the time. We know how much time we spend scrolling or consuming content. We have the time. What we are lacking is a method to dynamically change around us when things change. And, if you live in the UK, the weather is one of those very, very big factors, right? You have environmental factors, and then you have your personal life, your work commitments, your social life. Everything keeps changing. If there is a way to keep tabs on all these things changes, something that just pre-plans things for you as things happen to you and changing the weather, then that will help you stick to it more likely. And the third one is motivation. So what I found is that if you just build something that doesn't have that infrastructure of, it's okay, you missed a day, it's fine, there is tomorrow. Like, let's go together for a walk tomorrow. Don't worry about it. All of that really gives people, I think, the space to fail, so to speak, but also then to recognize their progress and their values. So this is how we're trying to tackle it.
Yeah, so you don't beat yourself up for not, making the time.
Yeah.
You can make up for it the next day, because I think we are our own worst critics as women. We really bash ourselves psychologically, mentally, and say things to ourselves you wouldn't say to your best friend.
We're so forgiving to anyone but ourselves.
Yes, yes, yes. We're all changing the mindset around what you're trying to achieve.
Yeah. And, the thing is, there are some facilitators. So what we're trying to do is we're trying to make it easy. So we plan things for them in their calendar. We change things when we need them to, and we help them to see the different way of doing it. But obviously, we need them to also want to find a new way. It's kind of like a conversation. It's not a one-way thing.
It has to flow both ways.
Yeah.
So with your expertise in behavior change techniques, can you explain how these strategies are integrated into the Outset Wellness approach to improving health?
Absolutely. Yeah. What we're doing is we're building something that helps people keep track of exercises in a very easy way. So the way that the app will work is basically by giving you notifications that you can just reply to very quickly. It will, let me just roll back a second. Behavior change techniques, yes. So the way that we're implementing behavior change techniques take multiple levels. We obviously want to help people recognize when something is working and when it isn't. So we have a section that will help people recognize their progress, not in a way that pushes for metrics or performance, but in a way that highlights any kind of progress and any kind of growth that they have made. So the idea about our progress and our feedback is that it needs to be positive and it needs to really highlight what people have done rather than what they haven't done. And that's one component. Another big component is to help people keep track of the workouts by notifying them and having interactive notifications. So what we want to do is basically to make it as easy as possible for them to tell us, yes, I want to do it. No, I need to reschedule. Yes, this looks good. No, it doesn't. So that we minimize friction and we minimize the level of commitment that we need people to have in order to interact with us. We try and make it as easy as possible. And then we try to customize the experience as much as possible. Obviously, the main point is that the AI will learn what you like and what you don't like, so that then it will kind of mold onto you. And what that really does is you kind of start thinking about it as a friend that you don't want to let down. And we saw this even in our beta testing. People were like, oh yeah, I started feeling bad because I saw that it was there and it made me feel good before. So I don't want to let myself and Outset down by not going for a walk today, which I think is really capitalizes on the idea of authority and also, like, once you build a relationship with something even, then that relationship can really be a catalyst for good behavior change.
I love that. Yeah, that accountability piece is very, very important in helping people stay on track.
And, one of the things we're thinking is, even given that we have the possibility to look into people's calendar, what we want to do next is have a social component to it. So basically get people to exercise at the same time if they can't be in the same physical space, but also go for a walk together. Obviously, in London, you have the problem that everybody's scattered all over the place. So maybe a virtual meeting where you both are accountable because you both have to do it at the same time can be more practical. But we also try and facilitate interactions with people when they exercise, because those really, really help with motivation.
Yeah, I love it. So, how do you see the role of technology in facilitating accessible and personalized healthcare? And what innovations are you most excited about?
Oh, that's a great question. Well, of course, the past couple of years have been completely revolutionized by large language models, for the better or for the worse. And I think that definitely is going to change the way that we approach technology as a whole. There is hardly anything that can't be that you can't leverage LLMs for. So definitely that's something that I'm looking forward to. But also big data and the possibility of really looking into patterns to predict what works and what doesn't for people. I think that is a really, really big piece for the personalization. So understanding what others like you and what you have done in the past and how this can inform what you do in the future and what you can do in the future.
Okay. So, your work focuses on the mind-body connection and its impact on health. Can you discuss some key insights from your research in this area?
That's great. I wrote a blog post about it because I wanted to put everything into a structure. But I would say the main things that I found are that, first of all, everything starts with the body, as we were saying earlier. So there isn't really a mind-body connection as such. It's just one thing. There's no division, even though the philosophers of a few centuries ago may have disagreed with this. But it is one thing, and everything that we do with our body impacts our mental health and vice versa.
Mm.
For instance, there was a study that I conducted when I was at Flow Health, where we looked into the relationship between stress and perceived pain in users of Ukraine during the conflict. And what
Mhm.
we found is that when people were really stressed, they reported pain as being much lower than it actually would have been otherwise. So the idea is that the relationship between how we feel physically and how we feel mentally is so intertwined that we really need to take care of our body when we take care of our mental health. And that obviously brings exercise into the mix. There is a really big connection between exercise and reducing symptoms of anxiety and depression, reducing stress. Really, it really, really helps kicking things into place. Sleep, your cravings, your overall risk of actually coming up with conditions later down in life. Chronic conditions are actually physical activity is actually a big factor for multiple chronic conditions later in life.
Interesting. So now let's look at the different publications. As a published author with over 25 publications, how do you contribute to the global dialogue on digital health? And what topics do you find most pressing?
So I spent the past, now almost 10 years publishing papers and researching. I think my work can be split into a few different categories. There's one that is about real world application. So during my work in industry, what I've done is I've helped develop and evaluate a lot of different products that are currently on the market. So we just published a study with Flow Health not so long ago about randomized control trial on the effects that Flow had on increasing knowledge and well-being overall. We did the same with BioBeats when we had our first mental health app to try and understand what the effects of the app were on reducing depression and anxiety in employees. So a lot of the work that I've done was to basically give evidence that products that are on the market actually work. Because I think that is one of the biggest problems that we currently have. There is a plethora of different apps, a plethora of tools, and we really don't know which ones do the things that they claim they do and which ones don't. So for me, that was a big point in my career, really trying to put the science into the business.
Yes.
And then you asked me, what am I excited about? I think definitely a recent paper that I wrote with some other co-authors really focused on trying to understand what the landscape is when it comes to evidence generation. So one thing that I'm really passionate about is making sure that companies don't claim things that the products can't do, but also that they try to embed science from the start because it will help them later down the line. And that's what we're trying to do at Outset. We're trying to embed outcome measures right from the beginning so that we know that we are measuring what we intend to measure.
That's awesome. It is all about the data.
Yes.
So, what are your future goals for Outset Wellness and your career? And how do you envisage the evolution of digital health in the coming years?
Well, when it comes to Outset, I think what we really want to do is, first of all, build a great product with the end users. So we want to try and release it to the public and really get a lot of feedback and really get it where it needs to be so that it's engaging, it works, and people really love it. Because that will help us when it comes to actually getting them to establish exercise routines. The next step would be to get into primary care. One of the things I would really like is for this to be a preventative measure that is described by GPs, by healthcare systems, as something that can really help prevent conditions that you might otherwise develop.
Yes.
The same can be true for attenuating symptoms of disorders that you already have. So for me, the healthcare piece is really, really important. In terms of trends in digital health, well, I think we're coming at a very, very exciting times, or a very exciting time, especially when it comes to diagnosis and treatment of disorders. The ability of big data models to pick things that the human eye can't pick is really something that I think can help us in the long term.
Fantastic. Now, my last two questions are going to be a bit of a time experiment.
Okay.
I'm going to teleport you into the past to that young woman who came up with an idea, decided to branch into business. If you could go back and have a conversation with the younger you, based on everything you've learned up until this point, what 3 nuggets of wisdom would you go back and tell her?
Oh, wow. That's quite emotional as well. Definitely stop bringing yourself down. You're more than you think you are, and you have it in you. That's one. The second one is keep reading and keep staying curious. Don't ever let that go. And never accept no for an answer. Because a lot of the things you get in life actually come from perseverance and just sticking to your guns.
The last question, I'm teleporting you into the future.
Mm.
We're going to go and have a conversation with the 90-year-old you. And you're sitting in your rocking chair, surrounded by your children, your grandchildren, your dogs, and your cats. If I could teleport you into the future to meet this wise woman who's led you to that point, what will you say to her when you finally meet her?
Well, first of all, now you can rest a bit. Like, finally, just take a breath and, enjoy yourself, because there wasn't a lot of that. Thank you for always having the grit that we needed, and be proud.
That is absolutely beautiful. I love asking that question because a lot of women don't realize that the wise woman is already in them.
Yeah, that
She's
is
that
true.
little silent voice that says, say yes, say no, go left, go right, grab this opportunity. But we don't trust ourselves as women to listen to that inner voice and wisdom. So
Very
thank you
true.
for listening to your voice.
Thank you.
Thank you for following her, and she will guide you to great places, I'm sure.
Thank you. That was emotional. I loved it.
Thank you, Sonia. And thank you to everybody who's tuned in today. The Her Story Circle is a platform that brings you the stories and voices of women from all over the world. We tell our stories to uplift you, inspire you, energize you, and empower you. So tune in again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world. And Sonia, thanks again for the interview. Welcome to the Her Story Circle podcast, the podcast that brings you the extraordinary tales of everyday women who are changing the world. I'm your host, Gertrude Mache, and I'd like to acknowledge traditional custodians of the land on which we meet today. I also like to pay my respects to elders, past, present, and emerging. Every week, we dive into the lives, challenges, and triumphs of women from all four corners of the globe. We're here to inspire, enlighten, and connect, sharing stories that uplift and empower. So grab a cup of coffee, settle in, and join us as we explore the incredible journeys of women shaping our future. This is Her Story, where every woman's voice matters.